we're going to publish our result after we finish the phase 2 clinical trial in U.S. We're going to have government support to help the veterans who suffer spinal cord injury from the war, from Iraq. So we'll be in contact by them, by veteran associations. So once we have a phase 2, I'm pretty sure the news will spread over. We'll help those 32,000, handicapped, the wheelchair, soldiers, and we'll help them. And I'm pretty sure we'll help the medical society to cure those patients, which no one has done it before.
Working in Rakuten Medical, I felt that all the employees are very passionate about their mission to conquer cancer, and the corporate culture itself also reflects upon this solidarity as a team to make the patient's life better.
Messenger RNA is the first drug of its kind. The ability for this molecule to be delivered safely and effectively and get inside of a cell is very important, because as that mRNA gets in there, it can start to build life. Literally build and create life, whether that's a protein, an enzyme, a hormone, whatever the patient is needing, the messenger RNA molecule can build it.
Hope is innovation. So we are, I pin a lot on innovation over the years. It helps me get through many rough spots, thinking, well, in the future there may be a better treatment, because the treatments for autoimmune disease, really for many autoimmune diseases have not changed in over 60 years, and they have significant side effects. So the hope for the future is that there is a treatment that will, if it doesn't cure me, would control my illness better with less side effects, and that's a hope that all patients have.
Very excited of the results we've had so far. We've developed this new technology for the treatment of stroke, and we've had some very enthusiastic early results. NIH, I think, appreciates our advances, and we're looking forward to completing our clinical trials and really launching a product that could really make a difference in the treatment of stroke.
The amount of time and money that goes into the preclinical efforts that a drug company has to do, Jove can really speed along that process. Scientists who are still trying to learn from a traditional text protocol can get to that next building block faster in trying to develop a new drug or medicine.
SDRI was first developed the pluripotent stem cells without side effect. That is the world's first one, and also we can use allogenic source and autologous source, because we use mesenchymal stem cell to induce pluripotency only using natural compound. We don't have any artificial manipulation. NEPS, which is called NEPS, newly elicited pluripotent stem cell, will be overcome to incurable disease for incurable disease treatment.
We're independent. We have about 58 corporate partners across Canada, which fund our core operations. But we do work with different governments on certain projects that help us address those skills gaps I mentioned. We're really the only game in town, if we're talking about a national scope, focus on HR in terms of challenges and skills gaps. For example, we have a unique program, which is our student work placement program, which is a national co-op wage subsidy program. Last year, we funded and created almost 500 co-ops across Canada through this program. There's no other organization in Canada that does something like that.
That's what Deep Lens is doing. We're helping pathologists, we're helping care teams, we're helping the whole community that is trying to care for that patient get a better, more informed diagnosis so they can get on the treatments that are going to help save their lives.
Here in Philadelphia, we are at the epicenter of cell and gene therapy. The cell and gene therapy science and that innovation really started in the world. It started here in Pennsylvania, at the University of Pennsylvania, about 20 years ago. And over the last 2 decades, it has evolved, emerged. We are home to the first FDA-approved gene therapy, the first FDA-approved cell therapy, and that all started right here in Philadelphia. We actually refer to this region as Silicon Valley because of the cell and gene expertise that exists here.
Could we create a new modality of care which is for opioid abuse, for depression, for pain, and these technologies are all immersive virtual reality models, and they tend to take your mind sort of away from pain, and these are actual interventions. They're being put through clinical trials, so that was the work we showcased yesterday, and all of this needs to connect through AI and VR, and that's the role we play.